Can anyone tell me how many grafts will be needed to cover up my bald spots? I'm 21 years old, suffering from hair loss and thinning for the past 2 years. I've started finasteride 1 milligram and minoxidil 5%. Though these drugs have helped me a lot, I wanted to have a transplant. So can anyone tell me number of grafts required in my case? Please help.
Thank you for your question. You're 21 years old and you wrote that you have had hair loss going on for about 2 years. You've taken finasteride and you've submitted photos that show a fair amount of hair loss. You are using minoxidil as well and you feel like you've had some stabilization. So you're asking, as many people do, how many grafts and what's involved. Well, at 21, the level of your hair loss can be classified as a more aggressive type of male pattern hair loss. When we look at male pattern hair loss over a man's lifetime, there's something we call the rule of decades. And when hair loss begins in their 20s, well, 80% of your contemporaries have lots of hair and 20% have hair loss. As you approach the 40s and 50s, it becomes more like 50%. Now, mentioning this has a lot to do with the limitations of what you can expect with a hair transplant. And I'll also discuss with you an alternative that we've developed in our practice called hair regeneration that has helped a lot of people in a similar position as yourself. And I would just discuss for you the options that we would present for someone like yourself who comes to our practice. So once again, if at 21 you have been taking finasteride and you're using minoxidil, you've created some degree of stabilization. Now, clinically, it has been well observed that although finasteride and minoxidil can slow down hair thinning, it doesn't mean that it necessarily stops it. Now, it can be meaningful for, let's say, a male whose onset of hair loss is in their late 30s and early 40s to slow it down, and understanding that the rate of progression is different than a younger man whose onset was at 19, who is at the point that you're at right now. I would suggest that for someone like yourself who would come into our practice, that before we consider doing a transplant, that we would do an evaluation looking at your scalp with standardized digital photography and microscopy to determine relative percentages of miniaturizing or thinning hairs on the scalp. Like I said, finasteride may slow it down, but in many patients, people still progress in spite of being on finasteride. So now when you think about hair transplant, what is the limitation? Well, the limitation is the donor area. The donor area is the area in the back of the scalp that is permanently present regardless of the degree of hair loss. You think of the baldest man you've ever seen, and you know exactly what the width of the donor area is. A personal concern I have with the aggressiveness of follicular unit extractions, and a criticism that I have, is that currently, because of the nature of the surgery, so many grafts are being harvested outside the safe zone of the donor area. Unfortunately, one of the reasons why follicular unit extractions became popular had to do with the unfortunate scars that resulted from the strip method. And unfortunately, to me, it wasn't the method, but rather the communication about what to expect after harvesting the strip that ultimately led to this undesirable result. In our practice, we do use the strip method when appropriate, as well as FUEs, but we also have a very good explanation about what to anticipate, and we use cosmetic surgical techniques to do the closure, as well as wound healing material called acellular matrix. So before moving forward with a transplant, if someone like yourself comes to our practice, we discuss another option called hair regeneration. Hair regeneration is a method that we've developed of combining platelet-rich plasma. This is derived from your own blood and has the active growth factors and healing properties that we combine with this acellular matrix material. It has been observed serendipitously early on that thinning hair actually became thicker when the material was used to help heal the donor area of a hair transplant. Well, what we developed over the past several years is a method of delivery, formulation, a dosing, a technique, so that based on the age, the degree of hair loss, and the type of hair loss, as well as several other factors, we customize this treatment. This treatment is a non-surgical option. It's an injection treatment. And when we do these injections, we're able to stop the hair from thinning and actually reverse existing thinning hairs to becoming thicker hairs. The benefits can be observed over the course of a year to 18 months, and we follow our patients every 3 months to watch their progress. So in our practice, someone like yourself, before we would even consider a transplant, we would encourage you to consider hair regeneration. When you do a transplant, you can't undo the loss of the donor area. And if your hair loss continues, then unfortunately those transplants become more obvious. And in the standard model of hair transplant surgery, that usually means you are forced to have to do another transplant surgery. So for me, if I can help someone without doing a transplant, then that's a desirable option. So I think that observation for you will be very important if you were to undergo hair regeneration, because we still have to be sure that if we were going to consider a transplant surgery, that your results will be stable. You have to think of what you will look like 5 years from now, 10 years from now, 15 years from now. And as you may be aware, there are a lot of concerns about sexual side effects of finasteride. So you have to also think of the case scenario that if you had to stop taking finasteride, what would happen to your thinning hair with the existence of transplanted hairs? It's almost like you're trapped. So it's very important that you make these decisions with a full understanding of all of your options. This has been, for our practice, an incredible transformational process for many people. We have patients who are coming who have onset of thinning hair. We have patients who come who have had transplants done elsewhere, who are coming in to help improve the results of their transplant, both in the growth of the hair grafts as well as improving the healing of the donor area, and to stop the progression of the thinning hair. So they're getting 3 benefits. And then in addition, we're actually being found by a lot of people who have had a hair transplant and are considering a second one, and then they come across our information and they learn that when they come in for an evaluation, that there's a lot of thinning hairs mixed in with the transplanted hairs. So if you think about it, if we can thicken those hairs, then we can really have an impact that in many cases can be even more dramatically improve the coverage of the scalp than a hair transplant would. So clearly we're very excited about this option that we've developed to help people come from all over the world. But in particular, I think for a younger man with a questionable predictability of the hair loss or thinning pattern, the surgical option has to be really considered carefully before moving forward. So I know that we've added some more information into your thought process before you move forward with your transplant, but I think it'll be helpful for you to learn about this before you make a decision about surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.